With so many people testing positive, there's a higher chance you could come in contact with the virus. Elenee explains what you should do if and when you do come in contact with COVID-19.
Quarantining for 14 days sounds like a long time to just stay put at home, but it's a sacrifice health experts need to help contain the coronavirus.
The disease is invisible for lots of people in the community. They don't see people coming into the hospital. They don't see people getting put on ventilators in the ICU, and they don't see people dying from it.
But that's happening. Maybe not to you directly, but to your friends, or people you pass by.
Our case investigators are overwhelmed right now, so we really do need people to, if you test positive, we really want you to reach out to those close contacts that you've had to ask them to isolate.
If you're a close contact, which is within 6 feet of someone positive for more than 15 minutes, you need to get tested too. The CDC says you should be in quarantine until you get your results back. You can be an asymptomatic carrier.
With a disease like flu, where pretty much everyone who gets it knows it and is sick enough that they stay home and keep themselves away from others, with COVID-19, you can't really depend on symptoms to be your guide.
Then there's a gray space in between. There are many circumstances in all of this if someone were to test positive or if they were to be a close contact. What about those people who were in close contact with that close contact, but not the person who tested positive?
That's always a challenging question. We get asked that all the time.
Panhandle Health says think of it like a circle. The person who is exposed to COVID-19 should isolate. The next circle of close contacts have been exposed and need to get tested and quarantined until their test results come back. Those in the outer circle don't need to quarantine.
But if one of that first circle close contacts tests positive, then the circles begin again.
Health experts say getting tested is key, and to get the most accurate results back, they say that you should get tested between 5 and 8 days after you've been exposed to someone with COVID-19. Reporting from home, I'm Elenee for News Now.